What's up guys, it's Dr. John Ribeiro. Today we're going to be talking about arthritis of the knee. This is super common with most people in the United States. Depending on how old the patient is or how active they've been in their life, this is an extremely common pathology that we see all the time. So first, let's go over what arthritis is. Really, it has to do with the femur and the tibia, the two bones that make up the knee joint, with degeneration of the cartilage in between both of those joints. As that cartilage starts to degenerate, we start to have a little bit more pressure between both of these bones, causing usually a narrowing of that joint space. Once that joint space gets really narrow, you start to see small osteophyte formation, which is what you'd see on an x-ray. As those bones get a little bit closer, there's more stress on the actual femur and tibia themselves without that kind of weight distribution that you'd see with that normal cartilage. Once we get those osteophyte formations, we tend to hear a lot of that crispiness and typical crepitus that's normally seen with arthritis. So guys, if you start to feel a lot of that crispy feeling, there's a lot of knee pain, or from your doctor they've told you that you have knee arthritis, don't be alarmed. Although this is super common and a lot of times you'll hear that it can't be reversed, you can absolutely improve your pain and improve your level of functionality. So guys, how do you actually know if you have knee arthritis? So firstly, your knee is going to be fairly painful. Usually with activity, it'll be fairly uncomfortable doing things like walking upstairs, walking for longer distances, or even just standing on your knee for a long period of time. It's also usually very stiff. Occasionally, exercise can start to loosen it up a little bit, but sometimes you'll see the opposite. More exercise can sometimes equal more pain. So usually a very stiff knee joint is one of the big factors as well. Also, you'll usually have some sort of radiographic evidence. So what does that mean? An x-ray. If you go to the doctor and get an x-ray on your knee, you'll usually see a narrowing of that joint space with that typical osteophyte formation. So almost like little spurs going around the entire joint. Lastly, you'll really hear that Rice Krispie sort of crepitus sound within the knee joint whenever you're moving it back and forth. Those are going to be the hallmark symptoms of knee arthritis. So guys, as previously mentioned, although we technically cannot reverse the arthritic changes within the joint, we can absolutely decrease our pain and drastically improve our function. How we're going to do that? So first, what we need to try and do is improve the knee loading. So if you were to think about a table with 4 legs, if we were to cut 1 inch off one of those legs, the table would sit unevenly and those 3 other legs would wear down much faster than if all 4 were even. It's the same principle with the knee joint. We want to make sure that the knee is loaded nice and evenly, so then all the load is spaced out in between the entire joint and one section isn't being loaded more so than the other, causing that area to wear down more, get more osteophyte formation, and have more pain. Next, we're going to show you guys some exercises to optimize our knee loading and to strengthen the knee just to better support that joint. So guys, next we're going to show you some exercises that can help strengthen the knee joint and help reduce the overall loading on your knees to help improve your arthritis pain. First one's going to be a reverse lunge. We want to do this very gently, okay? Things to focus on, we want to make sure that that knee stays in line with the foot and the entire foot always stays firmly planted on the ground. You don't have to go all the way down, but this workout option gives you some scalability. So as you get a little bit better, you can go a little bit lower. Okay, so it's going to look like this. We're going to step back, come down, and then stand back up, back to our starting position. We're going to go back, down, and then back up. As you get a little bit stronger, you can go lower and lower, driving back up to that start position. Once again, make sure that that knee stays in line with the foot. What we wouldn't want to see is something like this. Knee going in, foot going straight. That would be no good. Always make sure those toes are gripping into the ground, tracking in line with our foot as we drive back up. So guys, our next exercise is going to be the bridge. So you may think, I'm working my glutes in this exercise, what does that have to do with the knee? Well, strong hips usually equate to a strong knee joint. The knee is a fairly simple joint. It's really just a hinge with some rotation. So oftentimes when we start to have knee problems, we have to look down at the ankles or into the hips, okay? Strong glutes and strong hips are gonna make sure that our knees do not collapse when we do bigger functional activities like squatting. So what we're gonna do for this, we're gonna lay all the way down, feet firmly planted on the ground, and all we're gonna do is drive up. Squeezing those glutes, raising those hips off the ground, hold, and then come back down. When we're pushing off the ground, I'm pushing through my entire foot, not just the heels and not just the toes. Once again, we're gonna push up, hold, and then come back down. In terms of scaling, we can make this more difficult by removing one of the legs. One leg up, bridge, come back down. So guys, as always, we want to make sure that our knees are in the same direction as the feet. Don't let them go out too much, but also don't let them go in. Just right in the same direction. So guys, possibly the most important exercise in terms of functionality is going to be the squat. We use this almost every single day, whether you know it or not. So if we're just sitting up and down from a chair, or getting up from any position, whether it's a couch or any stationary object, we're gonna be using this squat position. Things that we want to think about: feet firmly placed on the ground, toes gripping into the floor, and making sure that our feet are about hip width apart. As we squat, our hips come back and our knees come forward. It is okay if the knees track over the toes. If you're experiencing some pain with this, just shoot the hips back a little bit further until you can tolerate that forward knee loading. What we're gonna do is sit back and then come all the way back up. If this is too challenging to get super deep into your squat, feel free to use any stationary object as a depth marker. So if that means you only go here, that's totally fine. Remember, things that we're thinking about: feet pointing relatively forward and firmly on the ground, knees in the same direction as the toes, and feet around hip width apart. Once again, we're just gonna come down and then come right back up.